Good morning, Chiriquí. Welcome to Conversando con tu médico, talking with your doctor. Good morning, Jessica.
Good morning, doctor.
Today we have Jessica Bell here with me. My name is Dr. Shannon Tour, and she will be talking about sports injuries, how to prevent them, how to treat them, what you should be doing to keep yourself healthy. I have a special announcement. I would like to also remind everybody that the Red Cross is having their sign-ups today. Very important that everybody in the community get together, go over to the Red Cross, sign up to be a volunteer. They're looking for foreigners, they're looking for locals. Anybody that has needs to fill some time, please go over there. They will train you. There's so many things you can do within the Red Cross. They'll give you classes on CPR and first aid, how to be a search and rescue. You know, if you have special skill set, if you're a mechanic, if you're a doctor, if you're a nurse, and you want to volunteer some time, anybody with some skills, please go out there. It's from 10 a.m. to 12 a.m. at the local Red Cross office here in Boquete. It's located in the public market in front of Romero Supermarket. They're going to be there from 10 to 12 today. Normally the office is open from 8 a.m. to 4 p.m. Monday through Friday. And you can go and bring any donations that you might have. They're doing a lot of good in our community. They're bringing food and clothing to the most needy that need it, especially right now with the situation we're in and not having a lot of people able to go out and earn a living because of the virus. So we need the community to pitch in and help out within their community. It will make a lot of people happy, and it will make you feel good to be donating, doing something good for someone else. Again, the sign-ups are from 10 a.m. to 12 a.m. in the Red Cross office here in Boquete, which is located in the public market in front of Romero. You just have to fill out an inscription form, and we'll get you started. Tell you what you need to know, and a lot of these classes, I'm told, are online to get trained in certain areas at the moment because of the virus and not being able to have a lot of people getting together. Once again, you're listening to Talking with Your Doctor, Conversando con tu Médico, here on Radio Chiriquí 103.3. We are live on the air today with my guest, Jessica Bell. She is a physical therapist here in Boquete. Her clinic is located in front of Melo, a little bit down from the clinic I work in, which is Dr. Chen's clinic, the Clínica Especializada Boquete. Dr. Gomez and I work there. She works a couple doors down from us. Good morning, Jessica, once again. How are you doing today?
I'm doing good, doctor. How are you?
I'm doing very well, thank you.
Good.
I understand that you're here visiting between patients.
Yes.
So you've been quite busy lately.
Yeah.
So we were talking a little bit during the week what would be a good topic to cover. And we found that there's a lot of athletes in the area, and they enjoy doing their sports, their bike riding, their running, and soccer, and baseball, other types of sports. And sometimes they get injured.
Yeah, a lot. Well, let's talk about sport injuries. Sport injuries occur during exercise or if the patient or person are doing some kind of sport.
Mm-hmm.
It's not the patient doesn't need to do a special sport like basketball, soccer, football, or swimming. Even if the person are doing some kind of exercise like weight exercise, exercise with bandings, aerobics, walking, hiking, if they have an injury, we can call that like a sport injury. Children are particularly mostly affected with sport injuries because they are more active, they don't measure their limits. But also the adults have a lot of sport injuries. We have different reasons for that sport injuries. one of the risks for sport injuries are because they haven't been regularly activity. So we always say, if you're going to start to do some sport or some kind of exercise, try to start to do it slowly, at least 3 times per week, then you can do 5 times per week. So you have to be careful with the time of your exercise or your sports. Another risk, if this is the most important, if you don't warm up properly before exercise, or if you don't stretch properly before and after exercise.
I've heard 2 different things. He escuchado 2 diferentes teorías sobre estiramiento, about stretching exercises. Some people say that stretching is not good to do before exercises because your muscles aren't correctly warmed up to be able to stretch. And other people say if you don't stretch before you do some exercise, then you're still going to hurt the muscles and ligaments and tendons. But we know that it's recommended to stretch at least a little bit before starting any vigorous activity.
Es importante hablar sobre las lesiones durante el deporte o durante el ejercicio. No solamente necesitan practicar un tipo de deporte en específico, ya sea fútbol, baloncesto, béisbol o natación. Inclusive si las personas realizan ejercicios con bandas elásticas, ejercicios con pesas, caminar, correr, todo esto puede provocar una lesión. Los niños son más propensos a tener este tipo de lesión ya que son más activos, pero también se da mucho en lo que es el adulto. Hay diferentes riesgos o factores que pueden producir una lesión en el deporte, y estos son no realizar regularmente ejercicio, lo cual recomendamos hacerlo moderadamente por días o semanas, no calentar adecuadamente y no estirar los músculos antes y después de los ejercicios.
Very good. Okay, so just to let everybody out there know that we are doing this show in Spanish and English, or Spanglish, and Jessica just repeated exactly what she told me in English at the beginning of the show, just in case anybody was saying, wait, I don't understand. We're doing it, we're trying to reach as many people as we can, so it is bilingual. Also, you can send your questions in for Jessica or myself to my WhatsApp at 6-507-4299. And Jessica, just if somebody wants to talk to you, or they might have a sports injury, or they might want to talk to you about preventing sports injuries, learn how to stretch, where can they find you?
Okay, we prefer, because all the situation that we live in now, make an appointment, priority appointment. They can call us or text to us. We have 2 numbers because we are 2 physical therapists. My cell phone number is 62117011. And Belkis, who is the other physical therapist, her number is 67418115. I would prefer to call us and text to us before to come to the clinic.
So they can WhatsApp either of you, and you will both be able to answer in English if they're English speaking.
Also, we have an email who is physioelement@gmail.com, so they can email us.
And Physio Element is physio with PH or with F? PH. Okay, Physio Element. Okay, so we've covered a little bit about what can cause someone to get injured. For example, not properly stretching before exercising, trying to do too much too soon, not starting out slowly. Children are especially affected because they don't know either when to stop, or they're a lot more active, so they do a lot of things that can actually go out and get them injured because they're not told the correct way to do their physical activities.
Okay, so we can talk about the types of sport injuries that are very common. We saw a lot of at the console. We can talk about the sprains, who is the overstretching of ligaments that can happen in the ankles or even in the shoulders or arms. We have the strains, that is overstretching but of the muscle and tendons. That's very similar, but it's not the same. We have knee injuries that can see affected the meniscus, the ligaments, and even the bones. We have the swollen muscles, Achilles tendon rupture, fracture. This is a big fall or something. Dislocations. This is very common.
Those are common.
Yeah,
Yes, I can attest to that. Those
yeah.
are common.
And rotator cuff injury. This is one of the most common injury of sport or even exercise. Tenemos diferentes tipos de lesiones que se presentan al realizar deporte o ejercicio. Entre estas podemos mencionar los que son los esguinces. Se pueden producir esguinces en los ligamentos, en nuestros músculos y tendones, tanto en nuestros brazos como en los tobillos o piernas. Lesiones en las rodillas, puede ser lesiones de meniscos, ligamentos de nuestra rodilla, inclusive algún otro tipo de lesión en la rótula. Tenemos lo que es ruptura del tendón de Aquiles, que se encuentra en la parte posterior de nuestro tobillo, o inclusive una tendinitis. Fracturas, dislocaciones y lesiones del manguito rotador, que viene siendo las lesiones de 4 músculos muy importantes que tenemos en nuestro hombro.
And these injuries are normally due to, first of all, especially the ones to the muscles and ligaments, are because you're not stretching correctly.
That's right. If you're not stretching correctly, or you are overdoing too much, or you don't do the correct technique or the correct way to the movement.
Another one is overuse, using the
Overuse.
same muscles over and over, doing
Yeah.
the same movement. For example, a pitcher in a baseball game
Yeah.
that does the same fast pitches and curveballs and that kind of thing. The repetitive motion in the arm and the elbow can actually cause injuries to the tendons, ligaments, and muscles.
Yeah.
And the fractures are more due to accidents
In
during
the sport. Yeah.
during the sport.
Yeah.
And the rotator cuff obviously is associated more with football and
Yeah.
basketball and
Yeah.
baseball, that you're using your arms a
Yeah.
lot. And we've noticed as doctors, and I'm sure you've noticed too as a physical therapist, that probably the strains and sprains are the worst ones to recover from. They take the longest, even
Yeah.
longer than
Got a fracture.
most fractures.
Yeah.
Not all fractures. Some fractures are extremely difficult to heal,
Yeah.
but the ones that bother the most are the sprains and strains.
Yeah.
Because you don't get the muscles and ligaments and tendons need time to heal, and we're too impatient and we go out and do things too soon, keep doing it thinking, oh, I just need to work out the pain.
Yeah, exactly. Okay, we have some advice for sport injury treatment that the person can do at the moment that they have the injury. And this advice is not just from us, the physical therapy, also the doctors recommended it. And we call it RICE, R-I-C-E. This method is very good after the moment you feel that you have an injury or pain in your muscles or your joint. You can rest, use ice, compression, and elevation. What that means, if you do rest, if just take a moment, don't continue with your exercise
Exactly.
because you don't know what is happening, so you need to stop. Use ice because probably the place of you have the injury is swollen and even it's painful, so the ice is the best medicine in that moment. Compression, not too tight, yeah, but use it in for support. And elevation of your injury, or if it's your leg or if your arm, try to elevate it more than 90 degrees. We recommend this if you can't go to the doctor in the moment, but we recommend to go to the doctor always after to have any kind of injury, because you don't know if it's your ligament, if your bones or something, but at the moment you can do this at home.
I get a lot of patients, and many of them come in a couple of days, a week after the injury, and it's actually gotten worse. They came in because it didn't get better, it got worse. And some, when we go to take an x-ray or to do the exam, we find out right away, oh, this is a ligament injury. It needs to be immobilized, it needs to have ice, it needs physical therapy to help start healing, because the person has continued to use it, so it's actually getting worse. So, before you obviously, like Jessica says, rice, rest, ice, compression, and elevation. And as soon as you can, go see your doctor. If that did not, make you feel any better, if you're still in pain, go see your doctor, get it checked out, maybe need an x-ray. We'll be glad to see you at Clínica Especializada. You can either call 720-2080, or you can WhatsApp me on my cell, 6507-4299 for an appointment. And I'll be glad to take a look, send any necessary tests, give you advice, and see if maybe we need to send you to physical therapy to continue with the healing process.
Sí, es importante luego de tener una lesión utilizar la técnica RICE en casa. La técnica RICE significa descansar. Luego de tener una lesión es recomendable no seguir con su ejercicio, esperar un momento para volver a recuperarse, utilizar hielo para la zona de dolor, ya que puede haber inflamación también, y compresión en el área puede ser con una banda elástica, no tan fuerte, con una toalla, y elevación, elevar el segmento corporal a un nivel de 90 grados, ya sea las piernas o ya sean los brazos. Eso sí, inmediatamente no puede consultar al médico, sin embargo, pues lo recomendable es ir inmediatamente donde su médico para determinar qué tipo de lesión pudo haber tenido, ya que puede ser ligamento, puede ser músculo, inclusive puede ser hueso, y es importante pues darse un chequeo luego de una lesión.
Muchos pacientes aparecen primero con su fisioterapeuta o alguien le dice, no, eso mejor ir con su médico primero y después, si todo está bien, venga conmigo y hacemos los ejercicios, los tratamientos necesarios para mejorarte. Some people are sent to me from their physical therapist or chiropractor because they're not getting better, and the same physical therapist or chiropractor thinks that there might be something else going on. It's recommended that you see your doctor before you see your physical therapist, your chiropractor, to make sure there's no fracture or dislocation or something that needs to be treated before you start your therapy. The therapists are excellent, they know what they're doing, and they can identify right away that you need help, but many of them prefer that you come with a doctor's reference, saying what's going on, what kind of injury it is, and they confirm that kind of injury. They can also do diagnostics, but they prefer you get checked out first and make sure there's nothing that they can accidentally make worse by starting an exercise routine or physical therapy routine.
Yeah. Okay, how to prevent injuries, sport injuries, or sport injuries prevention? Well, the best way to prevent a sport injury is to warm up properly and stretch always before and after exercise or a sport. This is the most important way to prevent any injury. But we have another kind of advice to prevent different injuries. For example, use the prepared technique to exercise. Learn the prepared way to move during your sport or activity. It will be better for do your exercise in a good way for prevent the injury. Some patients always, like I said the last time that I was here, like to look on Google how kind of exercise they can do at home or what kind of stretch they can do.
Right.
I like to say that all these exercise are okay, but not all the exercise are good for each person though.
Right.
So they have to be careful with this kind of exercise that they see on internet.
Right. Not all of them show the proper technique.
Yeah, if they want to know a stretch correctly one part of their body, they can come to us, to the physical therapist, and we will show to them how to do it correctly so they can prevent an injury.
Okay.
Una de las principales formas de prevenir lo que es las lesiones en el deporte es realizar apropiadamente un calentamiento y un estiramiento antes y después de realizar el ejercicio o el deporte. También es importante saber utilizar una técnica apropiada para realizar estos estiramientos, ya que no todos saben realizarlos correctamente, cuánto tiempo sostener el estiramiento. y tienden a buscarla en internet. En internet salen buenos ejercicios, pero no todos son adecuados para cada tipo de persona, cada tipo de cuerpo. Entonces, si necesitan ayuda en esto, el fisioterapeuta les puede realizar una rutina de estiramientos adecuada a cada persona para que realicen adecuadamente sus estiramientos.
And if someone is just starting out, they haven't done exercise for many months or many years, they might be out of shape, they might be overweight, they might have other health issues and movement issues, it's definitely recommended see your doctor, see your physical therapist. Ask. Prevention is the key, because once you get an injury, it takes a long time to heal.
Yeah.
It's better to spend a little time learning
Yeah.
than to get an injury and have to recover from it.
Yeah. Okay, another advice to prevent injury is have the proper equipment. This is important. When we talk about equipment, it's not just the weights, the bands. We're talking about your shoes, especially if you are doing running, hiking, or riding. You have to be careful what kind of shoes are you using. And sometimes the orthopedics doctor recommend, this is not publicity, but they like to recommend the Skechers, the brand, because they are some studies that say they have the properly way to wear your foot. It's good for walking, sometimes for running. So usually we recommend to our patient that kind of shoes. And it's
sturdy shoes with a good non-slip surface.
Yeah, that's very important, especially with these with boquete.
Yes, the streets.
Yeah, and we're talking about the shoes, the correctly weights if you're doing weights at home. If you're going to start to do some exercise on sport, don't start with 5 pounds or 10 pounds. You have to start at least with 1 or 2 pounds. It's not too heavy, but you can start with that way and do more repetitions.
When I do my dumbbell weights, my hand weights, I just use, instead of putting weights on them, sometimes I just use the dumbbells themselves and do my exercise.
Yeah.
Starting out as light as I can, and then increasing, maybe every 1 or 2 weeks, depending on my progress.
That's a good idea, yeah, depending on the progress. Some persons want to start like with more weight, and that's not the good.
A lot of, especially boys, teenagers that are trying to bulk up their muscles. They want to get muscles, they want to get a nice strong chest, upper body, and they tend to overdo it in the beginning.
That's right.
They want to be Superman and lift really heavy weights and show their friends, look at this, I can lift, and that's how they get the injuries.
Yeah, and when we have that kind of patient at the consult, we say, you can do less weight but with more repetition, so you will not have an injury on your arms or your legs, but sometimes they don't understand.
Right, because to build muscle, what they say is you need to add weight.
Yeah.
Do more weight and less repetitions. And to tone is when you do less weight and more repetitions.
Yeah.
But it's always recommended, start with the lightest weight, lots of repetitions, get your muscles used to the activity. If you're a kid, a teenager that wants to start lifting weights, you have to be very careful. You get an injury to cartilage, ligaments, muscles.
Yeah.
It takes a long time to heal. Some damage can be permanent.
Yeah.
So it's really recommended that you use a trainer if you're going to start lifting weights, and that you do it with another adult present to watch, make sure you've got proper technique, that you're not using too much weight.
Uno de los consejos para evitar lo que son lesiones en el deporte o al realizar ejercicio es utilizar el equipo adecuado. Cuando hablamos de equipo adecuado es utilizar los zapatos adecuados. Muchos ortopedas, muchos especialistas recomiendan la marca Skechers, ya que tienen lo que es la correcta forma de adherencia del pie y del tobillo, y estos son muy buenos pues para lo que es caminar o realizar rutinas de ejercicio o correr o montar bicicleta. También es importante saber que si está iniciando ejercicio con pesas, utilizar el peso adecuado, utilizar con con menos libras, ya sea 1 libra o 2 libras, y aumentar lo que es la cantidad, la dosificación o las repeticiones. Si va a utilizar unas pesas, si ya tiene bastante tiempo utilizando esta herramienta para hacer ejercicios, ya sea de 5 o 10 libras, se hacen menos repeticiones para no ocasionar lesión en los músculos.
Muy bien. Once again, this is an English-Spanish show. Jessica is only repeating everything we've said in English and Spanish for our Spanish listeners. You haven't missed anything. It's the same information. Any questions, again, you can send to my WhatsApp to 6507-4299. Okay, so if you have any questions for Jessica or myself about the topic or about any other topic, go ahead and write in. That's also the same number that you can use to make an appointment with me if you need a consultation over either a sports injury, training for sports, illness. I'm available. Or you can call and make an appointment, 720-2080. And Jessica is a physical therapist. She works at the Clínica de Fisioterapia Boquete. It's right next door to Dr. Chen's clinic, the Clínica Especializada Boquete, where I work. Her contact information she will give right now if you want to make an appointment with her, if you have consultations over this sports rehabilitation or prevention. You can give her WhatsApp or call her or her partner Becky.
Yeah, my cell phone number is 62117011. Belkis' number is 67418115. You can text to us or even call us.
And she will make an appointment for you and do an evaluation and,
Yep.
and help you out.
Yeah. Okay, continue with the how to prevent sport injuries. Another advice is don't overdo it. This is very important because when the person feels really healthy and they feel they can do more, they try to overdo it, and this can be wrong. If you don't get hurt, make sure you are healed before you start the activity again. Always try to do it slowly. Don't do the exercise fast, and don't do much that you can do it, because
Right.
that can hurt yourself.
Right. If you feel, the rule is if you feel pain, you should either slow down or stop.
Yeah, exactly.
And then go back to a previous weight, a previous exercise, or less. And obviously, if it's something that continues to bother you, you need to stop doing that activity altogether,
Yeah.
rest, go see a doctor, or your physical therapist that you're already using or that you have used, or consult with a physical therapist before continuing with an
Yeah.
exercise.
Yeah. Another way is cool down. This have relationship with don't overdo it. Remember to cool down after your activity, because if you continue to do it, the exercise or repetitions or whatever you are doing for exercise or sport, and you don't stop for a while, your muscle can have stress, and that can make different kind of injuries. So it's very important to cool down.
And the same line of that is that our muscles, when we use them, they do get little micro injuries to them naturally, and they produce the lactic acid buildup, and that's where the sore muscles comes from. And so you do need to rest, you do need to cool down, you do need to rest to prevent that lactic acid buildup, the small injuries to the muscles. Let the muscles heal. You can't do strenuous exercise 7 days a week.
Yeah.
You have to let your muscles have time in between to heal.
Yeah.
And use different muscle groups each time you do the exercise. If you do legs one day, do arms another day.
That's right.
Do shoulders another day, back and abs another day.
Yeah.
Don't do the same muscle groups over and over, because it produces small little injuries within the muscles.
You told something very important about the micro injury or macro traumatic
tears.
injury. Well, at consult, sometimes patients came and they say, I have this pain in my biceps or in my legs, and I don't do nothing. I don't know what happened, but it's painful or it's swollen.
Right.
And I say, well, maybe you just was training a lot, or you was overdoing it. That produce micro traumatic injuries, and that can be micro, and that can be a macro traumatic.
Right, it can get bigger.
Yeah, it can be
get
bigger.
worse.
Yeah, if you don't have careful with the repetitions, or if you're not careful with your resting time, that can be a micro.
Right.
Yeah.
Muscles do need rest between injuries. There is always a little bit of micro trauma to the muscles when you're doing a workout, and that's where the sore muscles come from.
Yeah.
That's why it's important to eat well, hydrate yourself well, rest after exercise, give yourself time to recover between types of exercise.
Yeah. Ok, para finalizar en cuanto a lo que es la prevención de lesiones en el deporte o al realizar ejercicio, podemos mencionar por último no realizar ejercicio más de lo que su cuerpo puede realizar, no le exija tanto a su cuerpo, todo debe ser moderado, dosificado adecuadamente para evitar una lesión. Es importante también que descanse entre sets de ejercicios o inclusive por día. De repente, si no hace ejercicio todos los días, bueno, hoy hace un entrenamiento, mañana su cuerpo descansa, el siguiente día hace otro entrenamiento diferente para no estresar los músculos, ya que esto puede producir diferentes tipos de lesión. También es importante pues cuidar lo que son los microtraumatismos. Esto quiere decir pequeñas lesiones que se ocasionan por realizar un movimiento repetitivo o por realizar un movimiento inadecuadamente. Estos microtraumatismos pueden convertirse en un trauma más grande y esto ocasiona una lesión mayor.
Okay. Again, Jessica was just translating from what we were talking about in English to Spanish for a Spanish-speaking audience. The goal is to exercise safely, avoid injuries so that you won't have any setbacks in your athletic training. If you do get an injury, stop immediately. Use the RICE method: rest, ice, compression, elevation. See your doctor. Doctor may want x-rays, may want another test, and may want to send you to someone like Jessica for helping with the healing process.
Yeah. So at the beginning we talked about the risks of sport or exercise injury. We say the mostly reason of that injuries is don't warm up properly, don't do the stretch before and after exercise, but I have another kind of risk for injuries. Well, the childhood, like I say, usually the children are more active, so they will be in injury more than adults.
They're more risk takers.
Yeah, they are more risky, but it's good to know that because some parents get scared because they are in injury always, but we can say that's pretty normal in childhood. The age is very important. If you are a person from 50 years old or more, you have to be very careful with the kind of exercise that you are doing because your bones are not the same, your muscles are not the same, so this can be risky for an injury. And also if you are younger, like 18 years, 20s, 30, you have to be careful because you feel more energy and you want to do more, but that can be not good for your body.
Right, you can actually do more damage than good.
Yeah. And another risk is the being overweight. If there is a person that wants to start to physical activity, exercise, sport, they need a guide. They need to start with somebody helping them because if they can't start with all the options that they have, because if they are overweight, they can hurt themselves, like knee injuries or back injuries.
And when that happens, an overweight person, they're already putting stress on their joints, on their back, on their knees, on their ankles, on their feet. Lower back is really affected. Not only that, also being out of shape, being overweight can't only produce injuries, it can also produce other problems. You have to make sure your heart can handle the exercise because there's more, the heart needs more force to push the blood through the body. There's extra veins and arteries that need to be reached by the blood from the heart, and the heart has to work harder. So you have to start it really slow. And another thing that I've seen with overweight patients is if they get an injury, they tend to say, okay, forget it. This is not for me. I'm not going to try exercising anymore. It hurts too much. It's really discouraging.
Yeah.
So my recommendation is definitely go to someone that can teach you how to first make sure your body's healthy enough,
Yeah.
your heart's healthy enough, and everything to begin a routine. Then go with a physical therapist or trainer of some sort to start slowly
Yeah.
to prevent injury while you're working out, so that you don't get that setback. Don't feel discouraged and don't quit.
Yeah. Al inicio del programa conversamos sobre los riesgos o los factores de riesgo más comunes al presentar una lesión, al realizar ejercicios o al realizar deporte. Que los principales factores son no realizar calentamiento o estiramiento antes y después de lo que es una rutina de ejercicio. Pero algunos otros factores de riesgo importantes son la infancia. Los niños son más propensos a padecer lesiones durante el deporte o ejercicio, ya que ellos son más activos que una persona adulta y es bastante normal que presenten un tipo de lesión muscular o inclusive una fractura. La edad también es importante, ya que si son personas que realizan ejercicio o deporte de los 50 años hacia arriba, tal vez no tienen la misma energía que cuando eran jóvenes. Entonces hay que tener cuidado con la rutina de ejercicio y con la dosificación con lo que la realizan. Igual si son adultos jóvenes, ya sea de 18 años en adelante, 20, 30 años, ellos sienten más energía, por lo tanto quieren realizar más de lo que deben, y esto puede tender a realizar algún tipo de lesión, ya sea muscular o ligamentosa. Y por último también mencionamos que las personas que están sobrepeso o preobesos tienden a lesionarse un poco más si no tienen la guía adecuada de cómo iniciar sus rutinas de ejercicio, ya sea para bajar de peso o para prevenir algún otro tipo de enfermedad, como sea una diabetes o una hipertensión.
And in an older adult, 50, 60, 70 years old, let's say they already have things like disc problems, cervical disc problems, lower back problems, and they try to do exercise, even just real mild exercise, but they continue to have pain. Is there something they can do to keep healthy but also protect those already chronic health problems they already have, like disc problems and that?
Yeah, well, we recommended to do the stretching, the exercise, but the exercise are specific for these areas, for this diagnosis or this medical issue. So for example, if it's a person who have problem in their discs, we recommend exercise for the back and the legs. But for that, we really like to talk to the people come to see us.
Right.
We will explain what kind of exercise they can do, because not all the medical issues are the same in each patient.
Right.
But in that situation, they have to be careful to do the
not-
exercise.
To not aggravate the,
to not
the
aggravate it,
previous
yeah.
injury.
Because in the case of a disc or a hernia, there is some exercise that can push more the hernia and that can make damage in the nerve.
Right.
So they have to be careful with that.
Right. It can actually make the injury worse,
Yeah.
and despite your best intentions trying to strengthen and tone and keep healthy, you're actually doing more damage.
Yeah.
So definitely go to the physical therapist, to your doctor, get recommendations from either one, so that you don't aggravate that injury any.
Yeah. Well, let's talk about the diagnosis of sport injuries. Well, many sport injuries cause immediate pain or discomfort. You can do our first advice at the beginning of the program, that was the RISE. But we recommend go to see the doctor. You can go to Dr. Shannon's office.
You're welcome to come see me, definitely.
Yeah, she will do a physical examination, and she will do a palpate your muscle. She will do some asking about what happened in the injury, what you was doing, and she will ask about your medical history, and she will give you some tests like X-ray, MRI if it's necessary, and depending what is her diagnosis, she will tell you if you need to come to see me to physical therapy.
Right, and I trust Jessica with my patients. I've sent other patients with her, and they have loved her. She does very
Thank you.
well. You know, she cares about her patients. She takes care of them. She gives them suggestions. If they continue to have issues, she sends them right back to us or
Yeah.
to their orthopedic surgeon to be reevaluated to make sure that nothing else is going on.
Yeah.
They have so much experience in recognizing injuries, recognizing when, okay, my patient is not getting better, and I got to send you back to your doctor to find out, to see if he can do some more tests, because what we're doing here, it's not helping right now.
Yeah.
And then the doctor probably give more tests and recommendations, and if a surgery or something is required, then obviously you're going to want to keep strengthening your muscles and keep
Yeah.
in shape before any surgery as well as after any surgery. And this is a topic we touched on a couple weeks ago.
Yeah.
We did a whole show on it. So here we have a guest with us. She is from the restaurant here in Boquete called Brasileirissimo. They make pizzas, they make meats, they make pastas, calzone, lasagnas, I guess. Is this a lasagna? ¿Es una lasagna?
Ravioli.
Right, uh-huh.
Brazilian facial.
Ah,
Brazilian facial. É um prato muito especial que eu que vai gostar. É de ravioli de queijo
uh-huh.
com a salsa brasileira. A salsa brasileira vem com salsa bolonesa,
Uh-huh.
hongos e jamão. E leva al horno se gratina com bacon arriba. E é muito bueno. Eu creio que vai gostar.
She's brought us some ravioli, some cheese ravioli with red sauce and cheese, a very Brazilian style. Once again, we have had pizzas, we have had chicken fingers, and other food.
Calzone.
Calzone. I hadn't tried all of the dishes yet, but they are delicious, and the restaurant is open. Siempre están abiertos de 10 a.m. hasta, no digo,
11 a.m.
11 a.m.
às 10 p.m.
Hasta las 10 p.m.
Take-out ou delivery, vocês 6546
Aham.
5663. Todos os dias estamos abertos.
Brasileiríssimos 654-65663, 11 a.m. to 10 p.m. Is the takeout, the delivery, and takeout is until 7 p.m.
Exato,
Uh-huh.
exato. E hasta las 10 delivery. Hoy, esta pasta es muy buena también. Tenemos, hoy no ha traído para que pruebe. Semana que viene voy a traer el pan con crema de ajo y queso, que es muy rico para que se comer de con la pasta. Es muy bueno. Creo que va a gustar. También tenemos los dos delivery, atende toda a área de Boquete. Y también llegamos hasta el Francés, Dolega, Algarrobos, Caldera. Entonces, quien quiere probar algo diferente, y hoy es un día especial, saludos a todos los estadounidenses, el Independence Day, hoy es un día very special,
We didn't say that. We didn't say Happy
very,
Independence
very
Day.
special day,
Yeah.
congratulations estadounidenses, hoy es un día muy feliz.
Happy Independence
Vamos a
Day.
conmemorar de una manera muy singular porque no se puede ir a las calles y hacer un evento grande. En su corazón siente la tranquilidad, la alegría de estar bien y de ser independiente. Y eso es muy bueno. Y gloria a Dios que Dios dio condición al hombre para que se torne libre también de la esclavitud de otros, ¿no?
Y los canadienses, el 1 de julio fue su día de Canada Day.
Oh, qué bueno.
Happy Canada Day,
Congratulations
1st
a
of
todos los
July.
canadienses.
Ajá.
No lo sabía. Entonces, saludos también a todos los canadienses, 1 de julio, el día de Independence Day, Canadá.
Canada
Que Dios
Day,
siga
Canada Day.
que Dios siga bendiciendo a todos los canadienses. Y que en nombre de Jesús seamos libres para hacer como tiene que hacerlo bien. ¿Sí? Y creo que una nación es muy potente y poderosa cuando se torna independiente de la nación que está esclavizada. Y gloria a Dios, Estados Unidos muy grande, como Brasil también muy grande. Entonces estaba hablando ayer con Jorge, hay diversidad de clima, diversidad de locales para que se pueda visitar, conocer. Y yo quiero conocer algunos locales de Estados Unidos, aún no conozco. Y creo que Dios va a dar
Algún
bendición
día,
para
algún
que
día.
sí.
One
En
day you'll
breve.
visit.
En breve vamos a tener brasilerísimo en Estados Unidos también. Estamos a programar mismo un brasilerísimo, quién sabe, Miami y también en Boston. Vamos a ver que Dios siga bendiciendo. Para que pruebe las delicias de brasilerísimo, 6546-5663. ¿Cómo están las patas? Las dos que están aprobadas.
This is really good.
It's very, very good. I never thought about putting bacon on my ravioli. It is awesome. You can't go wrong with bacon. Tocino es excelente con los ravioli. La salsa también, el queso,
the
todo bien
sauce is
fresco.
good.
Sí, bueno. Essa é a nossa salsa bolonesa, a ravioli à moda. Temos o ravioli à moda, a lasanha à moda, o espaguete à moda, o fettuccine à moda. Pode elegir qual pasta. E nhoque também, temos nhoque à moda. A salsa à moda brasileira é a salsa que fazemos com salsa bolonesa, hongos, jamón, e vai ao horno, se gratina com mussarela e bacon arriba. É muito rica. Recomendo que provem, que em minha casa também, meus hijos gostam muito dessa salsa.
Yeah, I recommend it. It's very, very good. It's very filling. You don't need a lot to fill up. Se llena rápido con la comida. It's warm. It's like a comfort food.
Especially for this weather.
Especially for this chilly weather that we are having today. It's actually very cloudy over the mountains today. It's raining. Está haciendo un poco de frío.
Está bueno para una pasta.
Es un buen día para pasta. It's a very good day to order your pasta. It's excellent. It comes nice and fresh and hot. Lots of cheese and sauce. It's got some mushrooms in there, some bacon. It was put in the oven, melted mozzarella cheese on top. They are open from 11 a.m. to 10 p.m. for delivery. To get delivery, call or WhatsApp to 546-5663. They have takeout from the restaurant until 7 p.m. It's just past Banco Nacional, National Bank, on the main street. Brasilerísimo is the name of the restaurant. We highly recommend the food. It's very good. We've gotten to taste quite a few of the dishes. And it's been excellent. And it was perfect just now because I was starting to feel a little bit chilly.
Yeah, me too.
Graças, graças. E hoje é dia do prato típico do Brasil, feijoada. Então, hoje, hasta las 4 da tarde, servimos a feijoada. Então, quem quer provar, vai já, antes que se acabe.
So they're doing the special dish today until 4 p.m. If you want to try it, it's a special Brazilian dish. Go by and try it. Go to the restaurant. They're going to be doing it until 4 p.m. today. Hasta las 4 p.m.
Exato.
Until 4 p.m. Bueno, muchas gracias. Como siempre, hemos disfrutado la comida. Muy sabroso. Lo recomiendo 100% si quieren una pizza, dedos de pollo, ravioli. Está muy sabroso. Se lo traen a su puerta. You can get it delivered nice and hot to your door. A pizza, ravioli, meats, chicken fingers, fish fingers. She delivers all the way down to Calera, Francés. Up here to Boquete, Alto, Bajo Boquete. So if you're in the mood, put your order in. The number once again is 546-5663. And they are open from 11 a.m. to 10 p.m. for delivery and take up until 7 p.m. But today, hoy solamente están abiertos hasta las 4.
No, hasta las 4 solo para feijoada.
Okay,
hasta
okay.
las 10 de la noche. Todos los
Okay.
días delivery de 11 de mañana hasta las 10 de la noche.
Okay, every day they're open, and they're open today also until 10 p.m. for deliveries. So put your orders in and get some nice warm comfort food delivered to your door. Muchas gracias por venir a alimentarnos. Muy sabroso.
Thank you. Congratulations. Every student Daisy. Happy day. Happy Independence Day every day.
Happy Independence Day every day. Yes,
Yeah.
celebrate your independence every day. Muchas gracias. Thank you very much.
Bendiciones.
Igual. So we continue now with Jessica. She's talking about sports injuries,
Yeah.
prevention, as well as treatment, and some other tips there.
Yeah. Okay. Well, for finish, I would like to talk about what kind of exercise you can do. If you are a person that doesn't do exercise frequently or doesn't like to do it, I just let you know to be active at home. If you can do your garden, if you can take a walk with your pets, if you can do your laundry, your bed, even that physical activity helps you. But of course, we recommend to do more than that.
Right.
Like-
More than just your housework.
Yeah, more than just homework. We can do moderate exercise or activity like walkings, dancing, hiking, riding, depending what do you prefer. If you want to do vigorous activity, well, we recommend the jogging or running, swimming, riding a bike, walking up the stairs and going down, gymnastic, sports like football or tennis, that's a good one.
And for older folks that already have limitations and can't get out and do too much, they can actually do chair aerobics, chair
Yeah.
exercises, not having to get out of the chair too much.
Yeah, for that kind of person, we recommend exercise even just sitting in a chair. Like using bands, using balls, using weights for the arms or for the legs.
The
even-
ankle weights.
Yeah, ankle weights, that's really good.
Leg lifts.
Maybe they look that exercise like bore or they like too easy, but they are not. Especially if you are not doing exercise before. You can do that kind of exercise with good dosification. If you don't know how to do it, you can contact us because we can tell you how to do it. We can show you the exercise that you really need. You can see it every day or 3 times per week by yourself, or even we can just go to your home 1 per week or 2 per week. That depends on the patient choose.
And
to
as
see-
they come along further, then maybe, once a week.
Yeah, to see the
or
progress, if we can
once
change
a
the
month, once or
exercise.
twice a month.
Yeah.
To
I
make
have
sure.
patients for exercise that I just see for one time per week. And the other days they do the exercise by themselves. Yeah.
Well, that's the way I started out 3 times a week with you. And
Yeah.
then I went down to maybe a couple times a week.
Exactly.
And then, all of this happened, and I didn't get back to doing my physical therapy. But with everything I learned from Jessica, I was able to continue to do some of the stuff in the house. And I would write to her, and I'd say, I would like to use a weight. Is that okay? I would
Yeah.
like to use a band. Is that
Yeah.
okay?
Good.
And can I lift my arm now?
Yeah, you just need to consult to us.
Yeah.
We will be very happy to help you.
Yeah. I mean, I'm a doctor. I know about injuries, but Jessica is the expert. And I want to do it because I push myself too much.
I know.
A lot of people push themselves too much,
Yeah.
and really they need somebody to hold them back. Or some people need the opposite. They
Yeah.
need pushing.
Yeah, that's
They're
right.
they're afraid it hurts.
Yeah.
They don't want to continue because it hurts.
Yeah.
Okay, so once again, Jessica works in the Clínica de Fisioterapia Boquete that is located across from Melo, next door to Dr. Chan's, Dr. Gomez, and myself, Dr. Shannon, the clinic, okay? She is available to either do house visits, and they are seeing some patients in the clinic, but with precautions both ways.
Yeah.
Either home visits or in the clinic are both with precautions.
That's right.
Gloves, masks, uniforms. The goal is to keep you safe as well as Jessica and Ducky safe
Yeah.
from the spread of coronavirus.
Yeah.
Go ahead and give everyone your contact information again.
Okay, my cell phone number is 6211-7011. Melky's number is 6741-8114.
Okay. And of course, if you need to see a doctor, you have an injury, a recent one that happened a while back, and you're trying to get help for that injury, trying to heal it, and it's not working at home, then come see me. Let me evaluate you. Let me do whatever needs to be done, and then send you on if required.
with a physical therapist such as Jessica. She is right next door. It's really easy to get a hold of her. And of course, the clinic number for myself is 720-2080 if you would like an appointment with me, or you can also get a hold of me on WhatsApp, 6507-4299. Some people find me on Facebook or online, that's fine too. I'm glad to give you an appointment and help you out. Jessica is as well, so is Becky. Remember that at the moment, the Boquete branch of the Panamanian Red Cross is holding their sign-ups for volunteers. We really need volunteers in the community. We can use everyone. We need professionals, doctors, nurses, paramedics, firemen, mechanics, anybody that would like to volunteer. There is the lady for volunteers as well. They like to go and visit the far-off places, deliver food, deliver clothing to the less fortunate. We have the search and rescue teams. We have basic first aid, life support, and all that. Classes available. Some of them are available online. You will be trained if you decide to be a volunteer and you have a special interest. You can be trained. Some of it can be done online, as I said. Today the sign-ups are from 10 a.m. to 12 p.m. at the Red Cross office in front of Romero Supermarket in the public market. Daily they are open from 8 to 4, Monday through Friday. You can make your donations, or I guess you could still sign up during the week. You just have to fill out a form, present the form right there in the office. We have foreign as well as local volunteers, and we definitely could use some more. So please go visit the Red Cross office if you have some extra time, if you have some skills that you can share. Please go and sign up. Jessica, any last words today?
No, well, thank you for everybody to hear us. You are very welcome to contact us. We will appreciate that.
And like I said, I do recommend Jessica. She helped me through my injury. I'm doing so much better. I'm very thankful to her and as well to my doctors. I'd like to thank Radio Chiriquí 103.3 for having us here, our engineer Bolivar. I'd like to thank Licenciada Jessica Bell for being on the program today from La Clínica de Fisioterapia de Boquete. This has been Conversando con tu médico, talking with your doctor, siempre cuidando tu salud. We're here to watch your health. We're on the air on Saturdays from 10 a.m. to 11 a.m. right here live on Radio Chiriquí 103.3. For any consultations with me, call Clínica Especializada 720-2080, 720-2080, or you can get a hold of me by WhatsApp 6507-4299. Once again, thank you very much for listening today, and we will see you next Saturday. Very nice.